Hello, everyone, and thanks for tuning in to Charlie Mike, hosted by me, Mike Buchanan. Today, we're going to be talking to Dr. Rodney Teague. That's the only time and the last time that I'm going to call him doctor, because he's literally like a good friend of mine. He's like a good work friend of mine. And so I'm not going to call you doctor the whole time. Is that okay?
Can I call you doctor?
Yes. That would be great. Oh my God. Could you imagine? Could you imagine how many people you would absolutely terrify if I actually had a doctor in my name? Like, it would terrify people.
It would be kind of fun.
People that know me, they'd be like, no. There's no way.
Secretly.
That dude's too twisted to have a doctorate, right? So Dr. Rodney Teague. Oh, I said doctor again. Dang it. All right, Dr. Teague. He's our local recovery coordinator for VA North Texas. So he's going to tell us kind of what a local recovery coordinator does, and it's going with the theme that we're going to be doing all month, which is mental health awareness.
Yes.
And so we just want to bring as much awareness to all of the ways that you can get started with mental health, or that you can be guided through your mental health process. So that's the topics that I chose because I used to be a peer. So I kind of know a thing or two about mental health, or at least the whole recovery aspect of mental health, which we will dig more into. So this is your camera. If I do something dumb, feel free to look into this, which is a great thing for you because you never get the opportunity to actually make fun of me when I say something dumb to you. You just look at me and shake your head like my mom used to do in shame. So
I didn't realize I was doing that to you.
No, it's okay. It's okay. I understand. I'm used to it. I get that reaction wherever I go, even at home. It's okay. So let's just start with this. Why don't you tell us a little bit about yourself? So, last four, your social security number. Do you like long walks on the beach? What do you like to drink?
Let me get my cards.
Any common passwords that you might use? I'm kidding.
I'm Rodney Teague. I am a clinical psychologist. I'm one of two local recovery coordinators here at North Texas now. And I'll tell you a little bit about what that role is. That role of local recovery coordinator means that I'm in charge of ensuring that we are keeping a recovery orientation throughout all of our mental health services. And we'll talk more about what we mean by recovery, here shortly. But that means I do a little bit of clinical work, only about a quarter time, and so that's individual and group settings. But I do a lot of education, and that's with staff, that's with veterans, that's with families. I do some community outreach, and I get to work with the peer specialists, as you know.
Yeah.
The clinical work that the local recovery coordinators do is primarily focused on the veterans diagnosed with what we refer to as serious mental illnesses, right? Mm-hmm. Psychotic disorders, mood disorders, post-traumatic stress, SMIs.
Yep.
Yeah, that's right.
Okay.
That's right.
Yeah, that's great. Honestly, I think that it's good that you are still active because honestly, a lot of people that get into the more administrative roles here are not active really anything anymore, which I thought was really weird when I first found that out. Have you ever noticed that though?
So one of the things that's interesting about this role is that it is designed to be in between management and frontline.
Yeah.
So I'm not an administrative supervisor.
Yeah.
That keeps me from having to do a lot of the paperwork and the other tasks that admin supervisors do. So it does allow me the freedom to be active directly with veterans, directly with staff.
Oh my God. So I'm going to equate this to a military position or rank, and everyone will understand what I'm talking about. He's a warrant officer. That's basically what he is. Yeah, he has the best of both worlds. Gets saluted, but has no responsibility. Yes. No, I'm just kidding. You have responsibility.
I have literally never been saluted in my life.
I know. But everyone in the military world will understand what I'm talking about. The warrant officers are kind of in between. Gotcha. They're not actually off. I mean, they are officers, but they're not. They're kind of right in between. They have an enlisted mentality of like, I don't really care, and kind of like, I'm going to do whatever I want. But then they also have to be greeted like an officer, so they kind of have the best of both worlds, right? They get to be treated like a gentleman, but act like a cowboy. So it's kind of great, right?
Yippee-ki-yay.
Yeah, that's right. I wish I could finish that, but this is a family-friendly podcast. Okay, so yeah, let's talk recovery. Okay, recovery is extremely important. It's literally a majority of my life. Okay, because like if I didn't have recovery, I'd probably just run around just like punching people in the face wildly or just yelling wildly at everyone. So thank you to recovery, and you should all thank recovery because I would be a nightmare if I didn't have recovery in my life or if I wasn't in the active process of recovery every single day and upkeeping with it. So. Sorry, let's talk about what it is.
Yeah.
I'm choking on my own spit. All right, so what is it? And then let's go deeper with not just what is it, but do you feel like I guess the majority of the mental health world really actually understands recovery? Right? Because I think it's a really good question to ask because I know that everyone wants to talk recovery, but most of the time when I was a peer, people that would talk recovery had absolutely no idea what recovery actually was. They were literally just going off of what a book said and they've never lived it, they've never experienced it, they never even tried to empathize with what it would feel like to be in recovery, and they had no idea what it was, and they're a medical professional, right? So let's kind of dig deeper into recovery.
Yeah, I want to kind of tackle that second part of the question first.
Let's do it.
And I think that's one of the best parts of my job is this recovery education piece, because I think we pay lip service to recovery and everybody says, oh, yeah. I know what recovery is. We've sat through the PowerPoints, right? I know my recovery language. I know what words not to say. And
they go, yeah, I've treated an alcoholic before. I'm a drug addict. I know what recovery is.
Right. That's the other part of it, is that we still think we're talking about substance use treatment only. And so this is a great opportunity, and I appreciate the opportunity to come on and talk about how recovery encompasses much more at this point. Now, we have imported the language of recovery and some of the concepts of recovery from addictions treatment, both behavioral and chemical. But now we're applying this to the whole of mental health and really wanting to include substance use disorders and behavioral addictions in that umbrella of mental health. And what recovery is about is it's about overcoming obstacles, because life is unpredictable and everybody's got obstacles. And so it's about overcoming obstacles. It's about overcoming stigma. We'll talk about that a little bit here. And it is for everybody. And so what it means that recovery is about overcoming obstacles is that, as I say, life is unpredictable. It throws us curveballs. Right? We just don't know what's coming. And every human being is going to experience sickness, loss, pain, bereavement, heartbreak, betrayal, all those things that we wish we could avoid. We can't. And so how do we get up when that curveball knocks us off our feet or we swing into our shoes and swing past that sucker?
Yeah, exactly.
And so that's what recovery is really, that's where it begins. And mental health struggles are obstacles. And recovery looks like somebody living their life in spite of the obstacles that they face.
Exactly.
Right. So that's what it is. That's what it is, and that's what it's about.
It's a great answer. It's a great answer. Mental health is huge in my life, and so it's naturally huge in my family's life too. For instance, when I first got sent away to an inpatient facility, right, for the first time to go and kind of work on my PTSD, my kids were really young and really didn't understand it, right? They didn't understand the whole process that I needed to go through for my own self to figure out, okay, like how do I get on the right path again or back on the tracks, okay? It's kind of like those little RC cars that you just squeeze the kind of trigger and they just kind of zip around the track, okay? And then every once in a while it runs off the track because you go too fast, okay? You go too fast and it spins off the track. And so I was really far off the track again. I mean, I was over into the wall over there. And so they didn't understand it. And so I saw this thing one time of this person talk about your life is kind of like a plate, right? So when you're first kind of like a kid, you have a perfect plate, right? You eat off of it, you do all these things. And then as life happens, as you eat off the plate, right, the more that you scratch it with a fork, the more that you scratch it with utensils, the more you accidentally drop it, okay, like it starts to become this cracked, kind of warped looking plate, right? It's just used, okay? And so then eventually sometimes some things come along and they break the plate, right? They just break it. They break the plate. And so I literally talked to them about, okay, I'm like a broken plate. Dad's like a broken plate, okay? And then we sat there and we talked about it and we put the plate back together, right? And so we glued all the little pieces back together, and it wasn't the greatest, but it still held food, right? So like it was still able to be a plate again. And I said, this is what I'm going to go do. I'm going to go away, and they're going to try to glue me back together, right? So that I can be a workable plate. I'm not going to be a pretty plate anymore, okay? But I'm going to be a workable plate. And that's kind of what I consider recovery, right? It's getting you back to be a workable version of you, right?
I think we live in a world, I love the analogy. I love the story about the plate. I think we live in a world where we insist that we and other people are perfect.
Yeah.
We insist that people are flawless, right? We insist that people are invulnerable. We insist that people have no weaknesses or flaws. And that's not realistic. We're all busted up plates.
Yeah.
Right? We're
Exactly.
all busted up plates. And we do our best to be workable plates.
Yeah.
And that's a nice analogy. I really like that.
Yeah, I mean, you're absolutely right. I think, I also told my kids, I said, how many percent of the human race do you think has mental illness? And they're like, I don't know, like 60%? And I'm like, yeah, try higher. And they're like, okay, maybe like 80%. I'm like, nah, higher. And they're like, okay, what about like 96%? I'm like, nah, higher. And they're like, wait, are you going to say 100%? I'm like, yes. Yes. And I think that the fact that you don't think that you have a mental illness, right, or any kind of mental health problems going on in your life as a human being, that's your mental health problem. There it is. You've identified it. Now go get help for it. Right? I mean, like that's the whole thing. Is just because you're dealing with life right now does not mean that your human brain is going to be able to deal with it on that kind of regular basis all of the time.
That's right.
You can be as healthy as you want to be. You can exercise every day. You can eat right. You can think right. You can meditate. But there will be challenges in your life that we've thrown at you that you will not be ready to handle. Right? It's just a fact, right? I mean, it's a fact. So yeah, every human being is susceptible to mental health in some way, shape, or form.
Everybody has highs and lows,
yeah.
and doesn't handle things well.
Exactly.
Has regrets, all of those things.
Exactly. I don't do the broken plate thing, but when I was a peer, I used to do the crumpled piece of paper. It works the same way, where I used to say, okay, so this happens to us, so we crumple this edge. When this happens to us, we crumple that edge. Okay, and then eventually we get, all these different things happen to us all across our life, and now we're all crumpled piece of paper. And then I'd say, okay, can we write on it? Can you read what's on the paper? No. Okay, well, what if I went to recovery? Okay, what if I went through recovery and I pulled out this piece, right? And then they pulled out this little portion, and they pulled out this portion, and this portion, and this portion. Okay, now it doesn't really look like paper, but can you read it? Yeah, I can read it. Okay, it's functional. Ta-da! Right? Like, welcome back to reality.
Right, and it can be repurposed.
It can be. It can be repurposed.
It was
especially negative things. God, it was like the best part of my recovery is when they took like a thing that I really hated about myself, and repurposed it.
Absolutely. I think that's a major part of recovery is learning that the difficulties, the symptoms, the negative aspects, those have to turn into, all right, how am I going to live with that now?
Yeah.
That's part of me. How am I going to turn that into something I can use?
Absolutely.
100%.
Absolutely, yeah. Go ahead.
Can we go ahead and talk about stigma here? Because I think
no, let's do it. Yeah, sorry.
I think no. I just
I'm holding you.
Listen.
I really love talking about recovery. Like it's one of my favorite things to do, because like it saved my life. So I love it.
Yeah.
Why wouldn't I?
I'm with you.
Yeah, but let's talk about stigma. Stigma's important.
That bit about this expectation of perfection is part and parcel of stigma. Right?
Yeah.
Is part and parcel of stigma. And I think that recovery is the opposite of stigma.
Yes.
Right? So we can think about, you have to understand stigma in order to understand recovery. Right? And stigma, I think, is a discrimination based on prejudice that is akin to sexism and racism and heteronormativity and transphobia and ageism and all the other ways that we can marginalize and separate people from the human family.
Sure.
Right? They're different from us, normal people, right?
Yep.
Is what we say, is what's said in stigma, right? And so it's based on this faulty way of thinking in all or nothing terms.
A maladaptive, illogical thought process.
Absolutely. Well, wow, did you just come up with that?
No, I've been through stuck point training. I've been through CPT.
Yeah, I get you.
Yeah.
Exactly. Maladaptive thinking, black or white thinking,
It is, yeah.
all or nothing thinking. And we could also call it binary thinking.
Yep.
Right? So normal versus abnormal.
Yeah.
Well versus sick. Doctor versus patient. Right? And those binaries, those all or nothing ways of thinking, aren't objective. They aren't objective. They come with moral judgments attached to them.
Yeah.
One term always has a moral superiority over the other. So normal is better than abnormal. Well is better than sick. Perfect plate is better than functional plate.
Yeah.
Right? And when we think in those ways, and when we see that people tend to think in those ways, we say, those of us with mental illness say, I don't want any part of that. So we keep it a secret as best we can.
Yeah.
We stay hidden. We stay in the shadows. And that keeps us from being able to accept those parts of us. That keeps us from being able to transform those parts of us into usable, functional pieces. Right? It keeps us from being able to live our lives.
Absolutely. You know, I'll tell you this short little story, and then I want to ask you a question. But so when I was deployed, let's talk about stigma just in the military in general. I said, so when I was deployed, okay, my first deployment, I went through a really horrendous contact, let's just say, okay? So like a firefight to where 2 of our people got injured. My team leader was injured extremely bad, right? Like where I had to help a special forces medic with his injuries. Okay. It was really bad. It was a rough night. I thought I was going to die multiple times during that night. Okay. So it was just rough. It was the first time I'd ever been in that experience. And so I had lasting effects after that, obviously, right? Like I didn't sleep for like 5 days. And then when I finally did fall asleep, like my platoon sergeant, I think I was on guard when I fell asleep, right? Which is a big no-no, okay? But it was during the day, and my platoon sergeant was like, just leave him alone. Like he's been awake for like 5 days. So like, I'm surprised he's not like seeing things at this point. And then I started having issues with talking to people and interacting with people. And like, I just had all these issues. And so then finally it got to the point where I felt like I was a danger to myself and others, right? Like being on the team. And so I asked to be removed to go and see mental health. And that was probably the dumbest thing I ever said, right? Because when I said that, then all of a sudden it was like, okay, now you're just being a pansy. Now you're being you're just trying to lie to get out of this, or you're trying to lie to get 100% when you get back, or you're trying to do this, or you're just trying to get out of the war, or you're trying to get out of here, or you're trying to go back to the main base to go and chill out and eat good food all the time instead of being out in the muck, in the mud with all the rest of us. And it had nothing to do with that. It just had to do with like, I knew that my mental health was going to cause problems, right? Like cause problems out in the field, get someone killed, or possibly like me kill somebody, friendly or not, because at that point I didn't see anybody as friendly or not, right? I just saw, are you a threat to me currently? Like that's all I saw, right? I didn't see uniforms. I didn't see faces. I didn't see colors. I didn't see genders. I didn't see race. I didn't give a crap. I just said, are you a threat or not? So like, even if it came from the inside, I would kill you. I would think about it at least. Okay. And so like, I was like, okay, I'm a danger. So I tried to take myself off. That's all I tried to do. I tried to take myself out of the functional series of events. And I got beat up and ridiculed, and like literally they beat the crap out of me in the freezer. Like I went in the freezer to go get food because like they put me in headquarters, like, you know, off the line. And then so when I went to get food out of the freezer for the cook, they like literally cornered me in the freezer and beat the crap out of me. All because I said I wanted mental health help. And so like that is the stigma that we're talking about, right? Like that's exactly what we're talking about, is like, that's crap. That's bull crap, right? Like I tried to do the right thing to keep all of you safe. And then you're telling me that I'm doing a bad thing for trying to be better.
I think it highlights a terrible story. You know, I think it highlights one of the foundations for stigma. Tell me if you think I'm right here or not. I think part of the reason that those men talk to you about, oh, you just being a pansy, you want to go back, because they don't want to believe that it could happen to me.
Possibly, yeah.
Right?
I think that's what I experienced.
There's some fear about like, oh, you know, that could happen to me.
You know, like you were talking about, you know, what stigma really is and what it's akin to, right? And, you know, I think it really comes down to ignorance. It comes down to and I don't mean ignorance as like you're an idiot, because that's not what ignorance means. It's not what ignorance means. Nope. Okay, ignorance just means that you have an absolute lack of information to be able to make a decision, okay, about something clearly or objectively, okay? And so I just think that they just don't know enough information about it, right, to make an objective observation. And you're absolutely right. I think that it is more akin to their fear of why they said things like that to me. Because when I went and got help, okay, and came back from help, a very different person, okay, very different when I came back. I was still active duty, and they said, wow, he's acting really better. right? Like I actually want to maybe, wow, okay, so maybe I am experiencing some things. And they'd come and ask me like, hey, how was it? Was it awful? Was it weird? How do I go?
How do I get involved in
How
that?
do I get involved in this? Right. And so like everyone was asking me about that behind the scenes. But then you realize like once you are sitting there and you're like, I don't care if you know that I went inpatient. I don't care if you know that I went and got mental health help.
Right.
Like, I don't care. Right. Like, and you talk about it more and more you talk about it, the more and more you influence people
That's
to do the right thing for themselves.
That's
right.
how you reduce stigma.
Exactly.
Right. And it's just like with other forms of discrimination. When people are ignorant about that group, that stereotyped group, then that maintains a stereotype. When we put people together and we educate people through their experience, then it reduces.
Yeah. All right. So let's ask this question. Okay. I know this is going to be a tough question. And I know that this is, okay, now listen, I'm going to preface this into the camera first. Okay. If you don't know about the mental health field, know this, okay, is that providers like Dr. Teague, okay, are very split on this one thing. Anyone out there that's listening will know about the whole argument between nature versus nurture, okay? It's an age-old argument, okay, that everyone has, okay? Are you doing something because you were born like that, okay, or are you doing something or because you were raised like that, okay? Like everyone's always like, okay, what creates a psychopath? Right? Were they born a psychopath or were they created into a psychopath? Okay. And so there's another age-old fight inside the mental health field. Okay. Of do I self-disclose information about myself as a provider? Okay. To actually empathize with your patient. Wink, wink. Okay. Or do I not disclose anything to protect my professionalism and the way that I professionally look, which means you need to be a perfect porcelain plate and not the cracked plate, because the cracked plate can't help people. And so that's an age-old argument. And so let me ask you this. How do you feel about having to be held to that kind of standard? And do you think that is literally just self-perpetuating the things and the stigma that the providers in the first place are supposed to be breaking through?
That's a great and rather complicated question.
I know.
That's okay.
You're welcome. I take this seriously.
It is remarkable how much stigma about mental health and mental illness persists within the field of mental health treatment. Okay? The third part that I mentioned earlier about recovery is that recovery is for everyone. And I think that this is a great time to talk about recovery is for mental health providers.
Yeah.
Okay. Mental health providers, depending on the studies that you look at, struggle with mental illness at well over half. Some of the studies, 60, 80%.
That's why they got into it in the first place, to figure out what was going on with themselves.
And that's kind of the joke, right?
Yeah.
That's kind of the joke about psychologists, about shrinks, about that kind of thing.
Professional manipulators is what I call them.
Well,
no,
you say a lot of things.
I do.
I think there is a standard, an unfair standard. I think it doesn't just come from the professionals. I think there's a large portion of the public that wants their professionals, their doctors, right, and their providers to be paragons of normalcy, right?
Sure.
To be perfect plates, right? Because, how could a broken person help me with my problems? How could a broken person help put me back together?
Yeah.
And I think that is a deep current of the stigma in our culture, right? Is that the ideal is perfection. Right? We've been talking about this. But the field doesn't do itself any favors by perpetuating this. I think it's in our licensure. It's in our licensure agreements and pronouncements about do you have any I mean, the wording varies from place to place, but do you have any defects that would impact your ability to serve your patients? And, those of us with mental illness wonder, what exactly does that mean? How do I answer that question? There are some lawsuits about that, about whether that's
it's like asking a question, have you ever stolen anything? Yes, I've stolen pencils or pens or a piece of candy from a bowl that I probably wasn't supposed to take. But so I have to answer yes to that question because yes, I've stole things. Right. That's ridiculous.
So I think a couple things. I do think that the matter of self-disclosure is one of personal and professional preference, and there are some clinical reasons not to self-disclose.
1,000%. If you work in a prison.
Really well, not only that, not only safety
saying, reasons. Yeah, I'm just saying that's a good one, right? Because then you have safety reasons why you don't self-disclose.
There are even reasons for the sake of the client.
Yeah.
Right. That this is going to be more productive more quickly if he or she doesn't know who I am.
Okay.
In a way. Right.
Okay.
There are some ways that certainly an argument to be made that that's the case in some senses. However, I think that selective use of self-disclosure is really, really important, and I think that we as clinicians can and do hide behind a facade of professionalism too often.
Yeah.
And I think that one of the reasons I believe that peer services are the tip of the recovery spear is because they are breaking down those old-fashioned binaries, that binary between doctor and patient, right?
Yeah.
Provider and patient in the same person. Are you crazy? Dogs and cats, right? And to be able to say that a person in recovery, a person who is experiencing obstacles and the overcoming of those obstacles is the perfect person to help.
Mm-hmm.
Now, that's not to discount the kind of expertise that my colleagues have, the education, the training, the supervised training. I mean, it's extensive and it matters. It matters. But I think there's a lot of room for providers to acknowledge their own recovery, their own need for recovery.
And to learn from it, right? I mean, to really learn from people like the peers. I know, when I was a peer, people used to look at us like we were pieces of trash a majority of the time, right? Especially providers. And I used to have to remind them, okay, that I'm not a piece of trash. Mm-hmm. And then I could literally do your job in my sleep. Okay, I understand that, I get it, okay? I can't do all the facets of your job, and I'm not even going to play like I can, okay? You have a degree for a reason. You have a doctorate for a reason, okay? And you have a professional license for a reason, and I totally understand that, right? But when it comes to connecting with someone, to really connect with someone and getting them to move in a direction that you're trying to get them to move in, which is what you're doing in the mental health field, right? Mm-hmm. That's why I call them professional manipulators, because that's what they are. They're professionally manipulating you into doing the right thing for the right reasons.
Hopefully.
Okay, hopefully, right? Mm-hmm. But they're guiding you in a direction like a lighthouse, okay, would a ship in the middle of the night. And so that's the big thing is I can be a lighthouse. That's the easy part, okay? The hard part is really untangling the webs and figuring out which thread has to go through which to kind of, you guys are really good at dismantling a bird nest, if you had a bunch of string that was all caught together. You guys are expert bird nest, take apart person.
When you were talking about the crumpled paper analogy, I was thinking about it knots.
Yeah, or knots,
and being able to slowly untangle, loosen the knots so that they can be untangled.
Yeah, we're more abrupt. We just kind of take a pair of scissors and we're just cut that one. And we're like, no, you don't need that. Yeah, and you're like, no, stop thinking like that. Cut, right? And so then we kind of prep it for you. That's what I always just tell people that. I used to tell people, we're the cowboys, you're the rancher.
Oh, that's interesting. That's interesting. Well, I mean,
we herd the cattle. We guide the cattle where it needs to be, okay? Yeah. And then the rancher takes care of the cattle once it's there.
Well, do I have time to tell you a little story?
Yeah,
about
absolutely.
myself?
Oh, self-disclosure is the best. It makes for the best stories. Please do.
Okay. And I'll start kind of at the end where we are right here. Because a really significant part of my own recovery is finding how I'm able to connect with the people who I have the honor of coming in contact with, right? Because of my experiences, because of what I know from my own life. My my grandfather, starting way back, my grandfather was my hero growing up. This is my mom's dad. He grew up a dirt farmer, northeast Oklahoma, poor as poor can be. He fought and was decorated in the Second World War in the South Pacific. He came back from the war, and he went from being a stock boy at Wilson Meats to being its CEO. Real rags to riches, American self-made man story.
Yep, right? Real American story right there, yep.
Yeah, it really is. He had a 400-acre cattle ranch in Oklahoma, and that place was my world when I was growing up. You can imagine. It was my entire world. And he was powerful and also playful, and he was my hero. And when I was preteen, he entered into a business venture that went south. First thing in his life he touched, it didn't turn to gold. Business venture went south, company went belly up. He lost some money, but not that he or his family was ever going to feel. Man, oh man, he went into his room, he stopped shaving, he stopped coming out, he stopped eating, he was suicidally depressed. Several months later, he was admitted to the Menninger Institute in Topeka, where he underwent electroconvulsive therapy. It was there for 9 months or so. And when they finally found a medication that would work to bring him out of his depression, he shot the other direction. He went the other way.
Yep.
And he spent the rest of his life in a kind of a classic, what was called manic depression swing.
Now bipolar,
that's right, for the rest of his life. And it ripped my family apart. And, it was one of those kind of perfect families. And I love my family, and it helps to tear down the fantasy of perfection. Right?
Yeah.
But it's taken a long time to kind of figure that stuff out. Well, that was difficult enough. I'm going to fast forward some years, and lo and behold, in my late teenage years and early 20s, things got pretty chaotic for me. And really difficult. I struggled with deep, dark depressions, and then the chaos of something else. I got flushed out of college. I was homeless and living in a car for a period of time. I had some run-ins with law enforcement, criminal justice, and won't go into a lot of details, but things were very chaotic. Eventually, I let my folks convince me to come back home from out of state where I was, and they took me to see the same psychiatrist that treated my grandfather. And he took less than 15 minutes talking to my parents, and even less to me, to say, yeah, he's got it too.
Yeah, but got what, right?
Yeah. Well, there were so many problems with that statement, and I spent the next 2.5 decades resenting that man and running full speed
in the opposite
direction.
Stigma incarnate.
In the opposite direction.
Yeah.
Yep, absolutely. So I self-medicated. I did my best. I struggled. Things remained chaotic. I always had people who wanted what was best for me and who believed in me, and people who stuck by me, and that really kept me alive. And I had a few other run-ins with mental health. They were things like, boy, why don't you stop pissing and moaning and do what you need to do? That's a quote from a psychiatric nurse. And each time I interfaced with the mental health system, it drove me further away.
Yeah.
And it has taken a long time and a lot of study. And the reason I'm here with this doctorate.
Yeah, I was about to say, like, why are you even here?
Well, is exactly what you said. They're trying to figure their own stuff out. Now, it has become a lot more than that, right?
Sure.
It has become a lot more than that, but that's certainly one of the reasons that it started. And it was through a lot of study, a lot of not just intellectual study, but not just practical study in the field either, but also a lot of spiritual study, a lot of spiritual searching, a lot of spiritual practice, and a lot of hope.
Yeah,
a lot of hope. And the thing that we talked about before, which is finding out that the curses or the demons or the problems have another side.
They do
have another side to them. So that the difficulty I have with so many different perspectives in my mind, in my head all of the time, well, that turns out to be, it can be very chaotic, but it can also be a real bonus, right?
It's a useful
tool. It can also
tool.
be a real tool. That's
It is.
exactly right. I have learned that there are so many different ways of seeing the world and being in the world that I got to figure out mine, and I don't have to adhere to other people's ideals of what I'm supposed to be. That has been really helpful. And like I said, this work of connecting with veterans, of connecting with clients on the basis of, I think I know what you're talking about, and I bet this too. I bet this. Is this right? Because this is the way it was for me.
And they're like, how did you know that?
Exactly. That's exactly right.
Wait a second.
Right. So that self-disclosure is a way of bridging that gap and being a human being, right? And being a human being. My degree then is for the purpose of getting access to have this chance to connect with people, right?
To be a part of the change.
I hope so. I hope that's true.
Yeah, I mean, honestly, thank you so much for telling your story. I really do appreciate it. And honestly, I wish more providers would be willing to tell their stories.
So do I.
I really do. I understand how some of them are trained to not self-disclose. And I do. And I appreciate it. I respect it. But like I tell every other provider that I've ever had, the first question because I ask questions. I interview my providers. Like, believe you me, okay? So the first question I always ask really is, can you take a joke? Okay, because like a lot of them can't, and if they can't, or they're like, what do you mean by that? I'm like, nope, new provider, right? Like, because I make a lot of jokes. That's what I do when I'm nervous or when I'm like scared or when I'm like uncomfortable about something. I make a joke about it, right? So that way I can kind of broach the topic without broaching the topic. Okay, I've always done it. It's a safety mechanism, but I need you to take a joke because sometimes I'll tell some wild jokes. Okay, but I'm serious about it. I need you to kind of like learn to deal with that. And the second one is, do you see your own mental health provider? Because if they're like, well, I'm not going to tell you that, great, I need a new provider immediately. Thank you.
You want to know that they're getting...
Yes, I don't care who it is.
Yeah.
I just need to know that you're going to see someone because like you're supposed to be a lighthouse. But if you're a lighthouse on a floating island, I don't think so, right? Because like then you're going to guide me to wherever you think I'm supposed to be, but like you don't even know where you're supposed to be. And so if you don't have a compass, how are you going to... It's the blind leading the blind. Okay, like I don't agree with that, and I'm smarter than that, right? I know that you're a human being just like me, and you're fallible. And so if you're fallible, or if you think you're beyond fallibility, okay, to the point where you don't need your own mental health professional, when you hear about everyone else's problems all day long, and you think that you don't need a check every once in a while, I don't want to have anything to do with you. Yeah. Honestly, I don't even know why you're in this job. Like, I don't even know why you're in this field if you don't know that much. Like, that should be like base common knowledge. That should be like a common practice. And honestly, isn't it kind of a common practice when you're going through the whole motions of becoming a professional mental health professional?
In some cases it is, but it became tricky for training programs to require that people go into psychotherapy. Because
you should be what you preach.
Requirement.
I mean, you should literally live what you preach. You should walk the walk and talk the talk.
My own psychotherapy has been extremely important to me, and I have been with the same psychiatrist now for the last 5 or 6 years. It's real interesting when I can tell the veterans that I am working with that I'm taking the same medications that they are.
Yeah. But I mean, like, I don't know. I know we're running out of time, so I got to kind of wrap this up. I didn't get to all my questions. That's okay, because we had a really good conversation.
This has been a good conversation.
It has. It's been a really good conversation. Honestly, we'll have to do this more often. We actually do it a lot. He talks to me so much. Like, I'm sure he's sick of me at this point. I'm the bane of Dr. Teague's existence. If you ever want to know how to get to Dr. Teague, you just let him know that Mike Buchanan said hi. And you'll be like, dang it.
Just start shaking.
Yes. So to kind of wrap this up, I wanted to kind of say this. Yeah, I think self-disclosure is super important, right? And I think that human beings are fallible, and that's okay, right? It's okay to not be okay, right? And I know like we don't say that enough, but it really is okay to not be okay. It's okay to not have everything all together. It's okay to not be the perfect Instagram, Facebook, Twitter, mom, dad, brother, sister, mother, cousin, whatever you want to say that you are. Okay, like we have these stupid, insignificant, who says that they should be standards, okay, for everything that we do as human beings these days, and it gets blasted in our face.
That's right.
And it's retarded. Like, who says? It's funny because it's kind of like what I ask my wife all the time during Halloween is whenever you walk by the candy and it says fun size, and I said, who in the heck decides? Like, who's the fun size police? Like, who goes, no, this is the funnest size that we can come up with? Who's the authority on fun size, right? You just picked a random size and called it fun, okay? That's literally what everyone else is doing. They're picking a random trend and they're like, this is how you should be. Stupid. You should be whoever you're going to be, right? And you should learn from the world, and you should do things the way that you're going to do things, and you should make sure that along the way you get help for mental health, or at least you talk to someone about mental health and you do check-ins, mental health check-ins. Everyone needs a Rock of Gibraltar. Everyone needs a lighthouse.
I'd like to see mental wellness programming for everybody who separates from DOD, for everybody who separates from the military.
Absolutely.
Automatic enrollment in VA and wellness programming.
I know, and everyone's going to scoff at it. They're going to be, oh, do I have to?
Yeah, whatever.
Honestly, it's not that hard. You go and you sit down and you just talk. You just talk. And even if you don't have anything to talk about that day, fine. Okay, but like at least you're going to do something. At least you're going to do a check-in. At least it's going to be regular. And then when you do have something to talk about, it's the same way when veterans are like, I don't need the VA, I'm not sick. But you might need them one day.
Right.
Like, God forbid you get into an accident. God forbid you fall off that motorcycle. God forbid you lose a leg to diabetes. Mm-hmm. Right? Like, God forbid any of those things ever happens to you. You'll need us. You'll need our services. I can guarantee it. And so, like, it's the same way with mental health, right? Like, you may not need us now, but 20 years from now, you might need us.
I think one of the dimensions of recovery transformation where we're not quite there yet is this. Yeah. If we're doing it right, then everybody should need our services, right? In this way, not mental illness services, but mental wellness services. Not everybody needs mental illness services, but everybody needs mental wellness.
Agreed. Yeah. Okay. Well, that's it. We have literally extended our time. This is the longest podcast I think I've ever done. Congratulations. Yeah, no, it was a lot to unpack, honestly. Like it's a topic that it has a lot to unpack to it. And honestly, I had like 2 more questions, but I'm not going to ask you. But yeah, so listen, thank you so much for being on. I really do appreciate it.
Mike, I appreciate the opportunity. Yeah. Really
it's honestly, it's been a pleasure. Thank you for your self-disclosure. Thank you for your candor. You know how much I appreciate candor. I really wish everyone could have a little bit more candor every day. Just a little, like my life would be so much simpler if you could just cut to the chase and tell me exactly what you need, and that's it.
I think you're a candor evangelist.
I am a candor evangelist. Yes. I like that. Have you ever seen the movie Divergent? Really? Go watch that. There's this whole sect of people in that they're all about telling you the truth and nothing but the truth. And they're like, thank you for your candor. So
that's you.
That's me to a T. All right. Well, thank you so much. I really do appreciate it. Listen, that's all we got for you this episode. So thank you for tuning in and watching us. It really does. I really do appreciate it. Please make some comments down below. No one ever really comments. I try to get people to comment, even if it's bad. You can just be like, I hate you, your voice sucks, and I think that you should go into a hole. I'm all right with that. That's constructive criticism, an opportunity for change. Okay, please follow us on Instagram, Twitter, Facebook, whatever you can follow people on. And always remember, listen, no matter how bad things seem to be, just Charlie Mike. All right, thanks a lot.
tread on me. Just let me be. At least I got something left